Updated clinical guidelines. Primary prevention of stroke. The overall landscape. Stroke risk can be diminished by adopting specific lifestyles as part of a preventive care attitude. These have been incorporated in AHA's Life's Essential 8. These strategies include the following: quit tobacco, manage body weight, cholesterol control, blood sugar and blood pressure management, sleep well, healthy diet, and keeping physical activity. Relevant issues. Higher stroke rates are observed according to the presence of social determinants of health such as lower levels of education, poor access to care, living in stressed geographical areas, socioeconomic disadvantage, and lack of social support. Cognitive decline is a common consequence of stroke sequelae, disability, and brain injury. Global risk factors for stroke. In some groups of patients, there is an elevated risk of stroke in apparent relation to specific factors such as endometriosis, early menopause, adverse pregnancy outcomes, systemic discrimination, inherited thrombophilia, sickle cell disease, and access to care. For all the following recommendations, just Class 1 and 2A of recommendation and Level A of evidence as per ACCHA guidelines are mentioned. Let's review some of the general recommendations to reduce risk for stroke. Patient assessment and diet quality. It is important to estimate the risk for atherosclerotic cardiovascular disease, for example, non-fatal stroke, among others, in people age 40 to 79 years old, every 1 to 5 years to guide the clinical approach. A Mediterranean diet is recommended in adults without prior cardiovascular disease or at high to intermediate CVD risk. In adults aged above 60 years old with uncontrolled blood pressure, with systolic blood pressure above 140 millimeters of mercury, and under treatment, salt substitution is recommended. General recommendations to reduce risk for stroke. Physical activity. Screening for physical activity is recommended in adults. 150 minutes of moderate intensity or 75 minutes of high intensity physical activity per week are advised. Additionally, to avoid excessive sedentary conduct, is suggested to engage in aerobic exercise. General recommendations to reduce risk for stroke. Weight and obesity. Screening for overweight and obesity is recommended in adults aged greater than 18 years old. According to recent data, stroke risk is enhanced by 10% for each 5 kilograms per square meter increment of body mass index. General recommendations to reduce risk for stroke. Glycemic levels. In diabetic patients with high cardiovascular risk or established cardiovascular disease and a 1C greater than or equal to 7%, GLP-1 receptor agonist is suggested. Cumulative data from randomized clinical trials has demonstrated that GLP-1 receptor agonists diminish stroke risk. General recommendations to reduce risk for stroke. Hypertension. In hypertensive patients, Stage 2 or Stage 1 with a higher risk of atherosclerotic cardiovascular disease, antihypertensive treatment to reach a goal lower than 130 and 80 millimeters of mercury is recommended. Suggested drugs as an initial approach are thiazide and thiazide-like diuretics or calcium channel blockers, angiotensin-converting enzyme inhibitors, and angiotensin receptor blockers. Greater than or equal to 2 antihypertensive drugs are indicated. General recommendations to reduce risk for stroke. Lipids. In subjects on primary prevention of cardiovascular disease, CVD, eligible to receive lipid-lowering drugs such as 20 to 75 years old with LDL-C greater than 190 milligrams per deciliter. 10-year atherosclerotic CVD risk greater than or equal to 20% or 10-year ASCVD risk greater than or equal to 7.5% and lower than 20% plus greater than or equal to 1 risk. Enhanced or statin treatment is recommended. At this moment, the effects of PCSK9 inhibitors on primary stroke prevention are not clear. No evidence of reducing first stroke risk by supplementing long-chain omega-3 fatty acids is available. Additional studies are required to test the usefulness of bempedoic acid in this field. General recommendations to reduce risk for stroke. Tobacco use. For active smokers, tobacco cessation pharmacotherapy along with behavioral counseling is currently recommended. cigarette smoking is related to ischemic stroke and subarachnoid hemorrhage. Point of view. In the clinical setting, physicians are pivotal in providing preventive care to patients at risk of first stroke. A brief presented here about the guidelines for primary stroke prevention, recently delivered by Bushnell C. et al., AHA and American Stroke Association, is a contributing tool to help patients get a better quality of life. Do you think this is an important issue? If so, let me know your comments, share this content, or deliver your insights by writing.